Have you ever prayed but never got an answer, and wondered if God was really there? Did you feel all hope was gone, but in His time He came along and answered the prayer you thought was gone? There is no prayer too small, for God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. Will ask, you shall receive. No matter what it is, I still believe. There is no prayer too small, and even when we fall, He gives us just exactly what we need. There is no prayer too small, for God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. No prayer too small. He always knows what's right. God hears them all. There is no prayer too small. My God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. No prayer too small. No prayer too small. God hears them all.
Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you. Let me be crystal clear to leave an everlasting impact upon you. Just imagine being buried alive. You're in a coffin, but you know you're not dead. You don't know how to get out of that coffin. You tried lifting the lid. The enormous weight upon the lid prevents you from opening that. You tried banging on the lid to unsettle the dirt that's upon the lid. So maybe somebody will dig their way down to help you. It doesn't work. You just think, today's your last day. Usually, though, people don't think about their overdosing possibilities when they're abusing drugs. They know they need help. They know they can't do it on their own, but they don't know where to turn for help. In reality, there are people standing right by your grave, their grave. They don't know that. They just think they're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind that maybe, just maybe, you might overdose and take something away that God had given to you, called life? With this, let me leave one last thought. Don't be the person I read about on these index cards that waited and waited and waited until it was too late. Instead, pick up the phone and call me at 844-405-HELP, and I promise I'll help you take your life back. Folks, please Call Larry Geis, Addiction Recovery Coach, Life Coach at 516-458-2741 or www.odysseyconsultant.org. Larry Geis and I tell people like you, it doesn't matter where you came from, it doesn't matter where you've been. What matters is that you want help and you need it now. Call him, 516-458-2741. He has over 30 years experience. Call Larry Geis at 516-458-2741. Despite the overdose epidemic in Georgia finally caps the number of opiate treatments. There's a fellow named Zach Talbot sees the irony of running an opiate treatment program from a former doctor's office. The funny thing is, a lot of patients are like, this is where I first started getting prescribed pain pills. That's what Talbot says. Now, the Tennessee native says those are the same patients that are coming to his clinic in Chatsworth, Georgia, a small city half an hour south of Tennessee border, to fight their addiction to those very pills. Outpatient clinics like the one Talbot co-owns dispense drugs like methadone and buprenorphine, which are legal synthetic opiates that block cravings and withdrawal symptoms. Federal health officials say this medication-assisted treatment, coupled by counseling, is the best way to treat an addiction to prescription painkillers or heroin. Patients are required to show up a set of number of times a week, the number of visits determined by how long they've been receiving treatment, to take their medicine in front of the nurse. Talbot's clinic, Counseling Solutions, started treating patients in February, but he says it's already treating 150 people in a space that fits about 200. There's such a need of this type of treatment in this part of the state, Talbot says. He's already making expansion plans. More than 1,200 people died of an overdose in Georgia in 2014, according to Centers for Disease Control and Prevention, with opiate drugs frequently implicated in those deaths. That's 10% increase over the previous year. So Talbot is outraged that Georgia has put a one-year moratorium on issuing licenses to clinics that use medicine to treat people addicted to heroin or painkillers. We're in the middle of an opiate addiction and overdose epidemic, Talbot says. You just think about it for a minute and you'll see. There are just too many clinics, people say. The reason for the moratorium, according to the state Senator Jeff Mulls, a Republican, is that the state needs to figure out why there's so many opiate treatment programs have opened in Georgia. Mullis sponsored the legislation, which has since signed into law, that created the freeze on new clinics. The law also required a committee to be established to look into Mullen's request. If you go to the parking lot of any of these clinics in northwest Georgia, Mullen says, you'll see as many Tennessee, Alabamians, North Carolinians, Kentucky tags as you would Georgia tags. People are driving from all over the South, he says, to get treatment there. Georgia has 67 opiate treatment programs, more than any other southeastern state. Tennessee has only 12, in contrast to Alabama, who has 24, and Mississippi only has 1. Only Florida comes closer number-wise, with 65 clinics, but its population is nearly double of that. I want to put on an NPR report about what's going on in Georgia, and I want you to listen closely to this, if you don't mind, okay? So let's go for it.
The state of Georgia this month stopped giving licenses to clinics that treat people with medicine to overcome opioid addiction. Research shows medication-assisted treatment with therapy is the best way to treat addiction to painkillers and also heroin. But some Georgia state lawmakers say the problem is there are too many clinics and not enough regulation. WABE's Michelle Alloy reports.
Zach Talbot says it's ironic running an opioid treatment program in this former doctor's office.
The funny thing is a lot of patients are like, this is where I first started getting prescribed pain pills.
Now, they're coming to Talbot's clinic in Chatsworth, just 30 miles south of the Tennessee border, to get off of those pills. Outpatient clinics like this dispense drugs like methadone and buprenorphine, which are legal synthetic opioids that block cravings and withdrawal symptoms. Patients show up to take their medicine in front of a nurse and get therapy. Talbot's clinic started treating patients in February, but he says they're already treating 150 people in a space that's fit for about 200. So he wants to expand.
We're either going to go out this way or, You know, like when schools do those portable classroom type things.
More than 1,200 people died of an overdose in Georgia in 2014, a 10% increase over the previous year. So Talbot is outraged. State lawmakers just put a 1-year moratorium on new clinics.
We're in the middle of an opioid addiction and overdose epidemic. You just think about that for a minute.
But far more clinics have opened in Georgia than in neighboring states, says Republican Senator Jeff Mullis.
In fact, if you go to the parking lot of any of these clinics in northwest Georgia, you'll see as many Tennessee, Alabama, North Carolina, Kentucky tags as you do Georgia tags.
Georgia has 67 opioid treatment programs, more than any other southeast state. Tennessee has 12, Alabama 24, Mississippi 1. Mullis says it's too easy for clinics to open here because Georgia doesn't require operators to show there's a need like other states, so it's open competition.
I don't want to take these facilities away from people who need it, but we need to manage and govern and regulate the ones that are here and the ones that are coming here.
There's also stigma driving the decision to put a pause on more clinics. Critics skeptical of medication-assisted treatment say drugs like methadone are just replacing one addiction with another. But that's how some people are able to function, says Jonathan Cannell, who heads the group Opioid Treatment Providers of Georgia.
If someone stays on a medication, that's not really the issue. People can still be dependent on something but not live in active addiction.
Cannell rejects Mullis's claim that Georgia clinics lack regulations. However, he does support the moratorium. His problem? There's no state enforcement that a treatment program is doing what it's supposed to.
We've had treatment programs open up. Some people with limited knowledge of the field. How do we know that they are functioning correctly?
And the Department of Community Health has only 3 people to keep track of the 67 clinics. But Georgia's clinics are filling a need that other southern states are failing to provide, says the Chatsworth Clinic's Zach Talbot. He knows because he's also in recovery. While getting his master's in social work 8 years ago in Tennessee, he was prescribed painkillers for some lower back pain. Then things spiraled.
And I still recall to this day learning how to help people with behavioral conditions in class and then going into the bathroom to shoot pills and or heroin.
He couldn't get a spot at a clinic in Tennessee, so he used to drive 4 hours back and forth from Knoxville to Georgia nearly every day to get treatment.
The old Zach, that Zach that was in that graduate program for clinical social work, quickly came back.
The moratorium went into effect June 1st. It will last a year to give the state time to look at new ways to regulate the clinics. For NPR News, I'm Michelle Alloy in Atlanta.
That was from Michelle Lloyd in Atlanta, and as you heard, it's quite concerning and alarming. While individuals who want to open a clinic in Georgia still have to fulfill multiple licensing requirements and approvals from both the state and federal governments, Mullis, who is the senator over there, says it's too easy. Unlike the surrounding state, Georgia doesn't have a certificate of need program for narcotic treatment centers. Those programs limit entry and expansion of some health care facilities by requiring operators to show there's a need for it. For opiate treatment programs in Georgia, open competition has been only the real constraint on the number of clinics there. I don't want to take these facilities away from people who need it, but we need to manage and govern and regulate the ones that are here and the ones that are coming here. So we need to have more enforcement. There's also stigma around addiction drugs used to opiate treatment centers because the drugs dispensed are opiates themselves. Critics say drugs like methadone and replacing one addiction with another, and that's quite alarming. Tapering off these treatment drugs is optional, and some patients can stay on them all their lives, and we need to nip it in the butt while we can. Jonathan Connell, who heads the Opiate Treatment Providers of Georgia, an advocacy group for state providers, say pushing people off medication-assisted treatment shouldn't be the focus of lawmaker efforts. If someone stays on medication, that's not really the issue, he says. People can still be dependent on something, but not live an active life in addiction. Connell, who operates 3 opiate treatment programs in southwest Georgia, rejects Mullis' claim that Georgia clinics lack regulations. However, he does support the moratorium. He says the problem is the regulations are not enforced properly by the Georgia Department of Community Health, which oversees the clinics. We have had some clinics open up, some people with limited knowledge of the field, Connell says. They are not received surveys. So we don't know what the outcome is. How do we know they're functioning correctly? The Department of Community Health has only a small staff to keep track of 67 clinics. 3 workers are there, with 1 person now in training. An agency spokesman says that rules and regulations also do not specify how frequently treatment centers should be inspected, but that the relicensure surveys are conducted every 2 years. There is a treatment shortage in Georgia, and we need to be alarmed by that, because it's not just the state of Georgia, it's the states around Georgia that are coming in. Alabama, you have Tennessee, you have Kentucky, you have even some coming from South Carolina and from Florida. Let's do something about it. Look into the opiate consumption in the state of Georgia, and listen to the NPR once more on this particular video. If you have any questions, feel free to get a hold of me. You can reach me at 844-405-HELP, and I promise you I'll help you with your opiate problem.
Have you ever prayed but never got an answer, and wondered if God was really there? Did you feel all hope was gone, but in His time He came along and answered the prayer you thought was gone? There is no prayer too small, for God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. Will ask, you shall receive. No matter what it is, I still believe. There is no prayer too small, and even when we fall, He gives us just exactly